All right, welcome everyone. This is another edition of 10 Minutes with JPIDS. I'm Ravi Jhaveri, Editor-in-Chief. I'm really happy to introduce my colleague, Dr. Rachel Epstein. Rachel, do you want to introduce yourself?
Sure. Hi. Thanks, Robbie, for having me. My name is Rachel Epstein. I am an assistant professor of medicine and pediatrics at Boston Medical Center and BU Chobanian and Abedisian School of Medicine in Boston, and a guest editor for the supplement we will be discussing.
Yeah, so thanks for that segue. Today we're going to be discussing the recently released journal supplement on viral hepatitis elimination in infants, children, and pregnant patients. But before we get to the specific supplement, I'm a superhero nerd, and so every superhero has an origin story. So I'm wondering, Rachel, if you could share your origin story about how you got involved in hepatitis as a research topic.
Sure. I guess it probably starts in terms of my interest in infectious diseases back in elementary school. I still remember in fifth grade watching a video in our health class about HIV where there were people dressed up as T cells and viruses, and somehow that has stuck in my head ever since, and something I've been interested in, combination of HIV and other infections throughout school and college. And then when I started my infectious diseases fellowship, after having done a med peds residency, I was very much interested in perinatal infections, and hepatitis C seemed to be an area ripe for research at that point. There was still so much that wasn't known. I think there's been a lot of research in the last several years since I started describing more so the cascade of care, and it's been an exciting time as treatment has been approved in kids, and so it's just been an area I've gotten really excited about.
Love it. And I think all of us appreciate your emerging leadership in this space, and we definitely appreciate it. So maybe you could start by giving our readers a high-level summary of what's included in the supplement.
Sure, happy to. So this supplement for JPIDS is focused on hepatitis B and C elimination, and with both a global as well as a US specific focus. There are review articles, there's new research, and summaries of some of the new guideline updates or recent guideline updates. And together, I think that the papers highlight the excellent tools that we have to combat both viruses, from antivirals for both to the hepatitis B virus vaccine to health infrastructure that we know works, from electronic health record reminders to telemedicine and educational initiatives to involve primary care and specialists together, and clinical guidelines that make testing and treatment more universal and easier to implement. However, it also highlights the areas where we still fall short. So, hepatitis B vaccine, while wonderful in preventing hepatitis B, is still not at the WHO elimination goals, and particularly in sub-Saharan Africa, where there are so many cases and so much more work to be done. In addition, hepatitis B virus diagnosis and treatment worldwide is far below levels where it should be. And then testing of perinatally exposed infants exposed to hepatitis C, as well as pregnant women. And we have guidelines that just came out, and the papers describe what the new guidelines are, both for testing in infants to do early RNA testing, as well as the 2020 guidelines that came out for universal testing for adults for Hep C, as well as for all pregnant women during each pregnancy from the CDC. And I think it points to ways to expanding that testing. We know that there are some increases that we have already seen, but we're still falling short, and there's still not enough infants tested for hepatitis C. There are disparities in terms of who is tested, and the same for pregnant women. And I think it also then points to ways that we can take those next steps to increase testing, to work across providers to see how we can improve our processes and share decision making for um, potentially treating in pregnancy, uh, either through shared decision making now or with more data in the future as well.
Yeah, I totally agree. I think maybe the one thing I would also add is that with sort of the massive population movement that's happened not only in our country but around the world, I think that a lot of these issues have come to light for many providers who maybe didn't expect it. And they're being asked questions about the need for revaccination for hepatitis B or initiating vaccination in places that they didn't offer it, as well as screening and triage for patients who test positive for various markers of hepatitis B. And what does that mean, acute versus chronic versus past vaccination versus false positive testing? And obviously, Hep C with potential exposures via blood or other fluids in other parts of the world and having to do that assessment. So I totally agree. I think it's relevant. So that kind of segues to my next question, which is, and you sort of already alluded to this with some of your prior comments, but how do you feel like the JPIDS readers can use this information and apply it to their own practice?
I think that's a great question. I think there are so many ways going forward, but one of the main threads that came through to me is really working together, primary care doctors with specialists and obstetricians with specialists, and really both for education of what should we be doing for testing, how do we communicate results from one place to another, whether it's from a parent to a baby and the exposure and what testing or treatment they need, or whether it's from one provider when someone is moving or uh, changing systems, et cetera. And so I think really that education piece, and I think just so everyone is aware of the guidelines, what they can do to test and to treat, as well as really make the understanding as titled in the intro article that it's elimination for everyone by everyone. We all need to be involved and know that it's both a priority, what these priority populations are, that pediatrics doesn't get forgotten, and that it's something that we can all help with.
And then the last question that I'll ask you about the supplement is, what is still left to do locally and globally? What are still the last frontiers we need to actually achieve elimination?
I would say there are still probably quite a few. I think a couple that we can work more discreetly towards are increasing some of the testing aspects. I think there's, as I said, education and trying to make sure that pediatricians are asking about, so that obstetricians are testing moms, pediatricians know that moms' hepatitis B virus results, and then are testing children, and then are actually referring those children to people treating hepatitis C. I think then at the next level for adolescents, as pointed out, there are great ways to potentially be universally screening adolescents who also have risks for hepatitis C, both perinatally cases not picked up, as well as risk through injection drug use. And then for hepatitis B as well, I think there's some of the same issues around testing and making sure that we're following all the proper guidelines. I know there's a little bit of a lack of literature describing that in the US as much, and certainly very different scenarios depending on where you are in the world and where people are within immigrant medicine. So I think there's a lot to do to make sure that we are testing everyone, that we're universally doing the hepatitis B vaccination, and then also the treatment. As you point out, there's so many questions about hepatitis B diagnosis, what the labs mean, and then also about who should be treated and what's the right guidance around that, and where should the treatment be happening. Sometimes it's in infectious disease, sometimes it's in GI. I think there are so many more things to really try and streamline that treatment, particularly in pediatrics. So many of the treatment guidelines and management guidelines apply mostly to adults, or the literature and the research is in adults. And so much more to learn in
Yeah, I
pediatrics.
just to remind everyone, if you haven't looked at the supplement, the title of our introductory piece is Viral Hepatitis Elimination for Everyone and by Everyone. So really not only including all the patients, but really also including any provider who at any point in the cascade of care is involved in assessment of patients and testing of patients and perhaps treatment of patients. It is all of our responsibilities to try to do whatever we can to advance the cause for elimination. So another patient is tested first, and then perhaps treated if they're an appropriate candidate. And maybe the one other thing I would just also add is that I think, as you alluded to, we've had a lot of historical preconceived notions and perhaps lanes, if you will, of this is the ID lane and this is the GI lane. And I think in order to effectively eliminate both of these viruses, we have to break down the lanes, and I think we also have to maybe get past some of the historical preconceived notions. The one I'm thinking about in particular is the idea that, children with chronic hepatitis B, if they don't have symptoms, they don't need to be treated. And I think there's some really compelling arguments that I've found very persuasive in the last couple of years about the power of cancer prevention with treatment that we really haven't prioritized or valued in the past. And so I do think this is something that's going to change. And I think this may become their responsibility where it becomes something that's managed in a primary care setting and not necessarily by an infectious disease or GI doctor. And perhaps, as you mentioned, there's maybe a lighter touch from the specialist side, but really it's falls into the care of the primary providers.
I agree. Yeah. I think there's so much that can be done in primary care. And we lose so many people in the referral to specialists,
Yeah.
I think. And so I think that could make a big difference in not losing so many people to follow up for sure.
Yeah, for sure. All right, since we've got a few minutes, are you up for one other question that's not related to the supplement?
Sure.
So since this is JPIDS, can you remember the first paper you published? And if you have a publication tip as an author, reviewer, or anything that you want to share with our readers and listeners.
Sure. So the first paper I published was on the cascade of care for infants exposed to perennially exposed to hepatitis C. So very much topic related. It was my primary fellowship paper. It was something I just started doing research during fellowship, really, and it was quite a process to go through. I think in terms of a tip for trainees or anyone just starting out, I think some of the things I find most helpful about starting to write a paper, when rather than staring at a blank piece of paper, starting with a little bit of an outline and really going towards the methods and focusing on sometimes actually even starting with the abstract of what is the question I'm trying to answer and what are the key points I want to get across, and then filling in all the little details is sometimes helpful.
Love it. That's such valuable advice. And I do some of that, maybe not as structured as you describe. I sort of throw all my ideas on paper and then start to rearrange and everything. So it's not the nice, tidy outline that perhaps you're describing, but hopefully it gets
Everyone.
us to the same place at the end, right? All right. Dr. Rachel Epstein, thank you so much for joining us. And to all of you, thanks for joining 10 Minutes with JPIDS. See you next time.
Thanks so much. Take care.